Researchers at the University of Pretoria have endeavoured to find safer methods for earlier diagnosis of brain tumours. They've developed a non-invasive system that measures intracranial pressure, a critical marker when diagnosing life-threatening neurological conditions. Now, this method promises to be a simple yet powerful diagnostic tool that enables earlier treatment, better outcomes and more equitable healthcare access. Head of the Department of Neurosurgery at the University of Pretoria's Steve Biko Academic Hospital, Professor Llewellyn Padayachy, joins us for more. Good evening. Thanks for joining us here on Late Edition.
Evening, Juliet.
Briefly, can you tell us how exactly this non-invasive system works?
So the principle that we've used uses the connection between the eye and the brain as a direct pathway for measuring intracranial pressure as a marker of brain health. There are a number of modalities that we use. So we started off using ultrasound, but now we use a mobile optical coherence tomography. We also measure the pupillary response, the intraocular pressure, and we assess perimetry and visual fields. So we use this linear model to decide what's normal and then abnormal in a way without raised intracranial pressure, and what that pathway looks like with pressure that's raised.
What real-world problems have sparked this innovation?
Yeah. So I'm a pediatric neurosurgeon primarily, who treats mostly children with brain tumors, and we've since I've come up to Pretoria advanced that to adults with brain tumors. And even though as a surgeon we want to remove these tumors as safely as we can, and limit the amount of neurological deficit associated, almost all the children that present to us with tumors that we should have diagnosed earlier. We know that the best predictor of outcome is early diagnosis.
Does the patient need general anesthetic for this, may I call it, procedure?
So our assessment technique, and there are various techniques that we've used. We've been fortunate enough to collaborate with some of the best in the world in some of these fields, and improve diagnostic accuracy in ultrasound of the optic nerve sheath diameter, for instance. But we've now, at the University of Pretoria and Steve Biko Academic Hospital, developed a multidisciplinary neuro-ophthalmology laboratory, which really allows us to assess a number of tools. To answer your question, most of these acquire, a few seconds up to a minute, depending on the modality. But no, patients don't need a general anesthetic, and it can be done at the bedside.
Which conditions could it detect?
So conditions causing raised intracranial pressure are things that really cause a disturbance in the sort of balance within the brain. So a brain tumor or any sort of mass that squashes the brain, things like infections, inflammation, meningitis, traumatic brain injury, a condition called hydrocephalus where there's a buildup of water in the brain. All of these conditions, the earliest way to detect them is to scan for raised intracranial pressure.
Now, it's been called a simple yet powerful procedure. Could smaller hospitals without big neuro departments use it too?
So that's the long-term goal. So we've got a lot of the big equipment, and we've got a tremendous sort of volume of talented basic science and medical registrar researchers who are collecting this data in a systematic way. It allows us to punch this big data model into some sort of mathematical model or artificial intelligence model, whatever you prefer to call them, and refine these diagnostic algorithms so that the software ultimately can be transferred onto portable devices. So the goal is to get this deployed, in the simplest way that one could acquire the data to rural clinics.
How soon could we see these machines, or this procedure, if you like, in hospitals across the country, rural hospitals, small hospitals? Are we at that point yet that they could go into mass production? I'm assuming there's a machine involved. Excuse my ignorance.
Yeah. So there's more than one machine involved. Remember, the data is acquired in a way. So, we're a while away from that. I started personally a while back when I worked in Cape Town, using ultrasound, and we refined, we said instead of acquiring snapshot data, we acquire dynamic video clips, and we use the cardiac pulsatility, as an additional measure. So that is something we refined. a lot of the equipment that we're using is already, mobile equipment. So refining them, onto smaller equipment will take a while. So we're still a while from, the point where we can say confidently it can be deployed. But the pathway and the endpoint are something that we've certainly embarked on and hope to get there within the next few years.
How difficult is it to get funding for studies like this and when you are looking for a solution?
More difficult than it should be. And look, the South African model is one that has allowed us to use, our need and our situation to be innovative and to drive innovative thinking. But, we're not at the level of acquiring or accessing the level of funding, research or otherwise, non-governmental or public-private partnership. But we're driving that. And through the University of Pretoria, with the tremendous support that we've got, we're, from our Faculty of Health Sciences, our School of Medicine, together we've identified this as a priority. And I think that's the best way to do it, as a multidisciplinary, collaborative focus within a research environment like we do at the Faculty of Health Sciences at the University of Pretoria, trying to access as much funding support as we can to drive this forward.
And lastly, what do you call it? Do you call it a system or a method or a procedure?
So ours is a diagnostic method, and it's not just one. It's various methods that we're using, in an algorithm to try and refine the linear pathway. So it's more than one method.
So fascinating. Thank you for sharing that with us this evening. University of Pretoria's Steve Biko Academic Hospital's Professor Llewellyn Padayachy chatting to us this evening.